Just a question or two about Amazon. You're aware of Amazon's use of independent contractors, I bet. Is that fair to say?
Yes, that's fair.
Amazon calls their delivery service partner program, or they should say they call their independent contractors their delivery service partner program, or DSPs. Does that sound? Are you familiar with this, broadly speaking?
Yes.
So these, as I understand it, this delivery service program employs about 300,000 people, and according to Amazon, none of these 300,000 people, their delivery service partner, so-called, actually work for Amazon, which is convenient because in reality, Amazon exercises enormous control over these delivery service partners. They control their contracts. They control every aspect of their business. They tell these partners, these independent contractors, which vendors to use, which routes to follow, you name it. They even monitor the performance of individual drivers. And in some cases, Amazon, unilaterally fire the driver. So my question is, does that really sound like, and your understanding of the law, does that really sound like a classic independent contractor? If
I'm sure you've heard the news. Senator Josh Hawley is on a mission to shake up Amazon and the health insurance giants. Today we're diving into a fiery antitrust hearing where Senator Josh Hawley took center stage. He hammered Amazon for its questionable labor practices and grilled health insurance companies for killing competition in the healthcare market. Senator Hawley zeroed in on Amazon's delivery service partner program, where over 300,000 drivers are labeled as independent contractors, yet Amazon controls their contracts, routes, vendors, and performance. This means no unionizing for better wages or conditions.
Well, not being a labor law expert, I'll give you my antitrust opinion. That
Good.
does not sound like a traditional relationship. No.
Yeah, it doesn't sound like it to me either, but it does sound convenient for Amazon in a couple of respects. I mean, first, it means that if these are all independent contractors, they don't, legally speaking, they don't work for Amazon, then that means that they can't organize for work and working conditions and better wages. Is that right?
I think that's right.
Yeah. So it's a great setup for Amazon. It's less clear to me why it's such a great setup for their non-employees, but the folks who aren't technically Amazon employees, but yet just happen to work every single waking hour just about for the company. Does anybody else want to weigh in on this, Ms. Cooley? Do you have any views?
I'm similarly not a labor lawyer, but yes, I can see why that would be concerning.
Don't you think that it also gives Amazon an advantage over other companies like UPS? I mean, UPS employs their drivers. They have to be responsive to their drivers. They have to negotiate with them. By treating them as so-called independent contractors, Amazon doesn't have to do any of that for any of their drivers, right? I mean,
So certainly having vertical integration can have anti-competitive effects.
Let me ask you, while I've got you all here, just on a different subject, just on the subject of healthcare for a second, and pharmacy benefit managers, and speaking about vertical integration. Why is it that insurance companies, why should health insurance companies be able to buy up the PBMs and also buy up the pharmacies? So that the PBM, as I understand it, is supposed to negotiate with the insurer and with the pharmaceutical companies in order to get better prices. But if the insurance company owns the PBM and they own the pharmacies, and in some cases they own the doctor's practices, I mean, who's really benefiting? Is that a good thing for patients? Do any of you think? I mean, is that degree of vertical integration, is that a positive thing?
No, it's definitely not. I mean, I welcome the recent investigation litigation against PBMs. We need more such investigations about their misconduct. I don't think that the price negotiations are even genuine. You think about all of the people that are uninsured and the price that they're supposed to pay, and then the price that is quote unquote negotiated is basically I wouldn't say fraudulent, but basically not truly a representative of what the two prices are.
Yeah, thank you for that, Professor Alford. I mean, that states my concerns very aptly. And it just seems to me that from a competition standpoint, if we are allowing this degree of integration in the healthcare market, if the insurance companies can own the PBMs, can own the pharmacies, can own the doctor's practices, in some cases now can own the hospitals, I mean, the only person who seems to benefit.
Unlike UPS, which negotiates with unions, Amazon sidesteps these responsibilities, giving it an unfair advantage. He didn't stop there. Hawley took aim at health insurers owning pharmacies and practices, driving up costs and squeezing out competition. But he's not just talking, he's acting. Hawley and Senator Warren have introduced legislation to stop these monopolistic practices. This battle is far from over, so stay tuned. If you care about fair competition and affordable health care, subscribe and share. See you next time.